So let's get started. And briefly, and this might be a bit of, some of you might already know this, but I just wanted to briefly kind of cover the international family of health and retirement surveys around the world. So starting in 1992, we had the Health and Retirement Study, which is a nationally representative panel survey of Americans over the age of 50 and their spouses, conducted every 2 years here in the United States. And this kind of became the study that most of these other studies copied from. And when we talk about harmonization, it's also the study, because it's been the longest running study, that we look to in terms of how best to harmonize, kind of as our base study. In 2001, MHAS started, which is Mexico. They had their first two waves in 2001 and 2003, and they also started back with a third wave in 2012 and 2013, which included a refresher cohort. ELSA is the English longitudinal study of aging, and it's a nationally representative panel survey of persons 50 and older in England, started in 2002. In 2004, SHARE started. And SHARE is a multi-country survey, so it covers a lot of European countries, including Israel. Its first wave was in 2004, and then in every wave they've actually added more countries. So SHARE continues to grow. It's a great resource. KLoSA, the Korean longitudinal study of aging, started in 2006 for the Republic of Korea or South Korea. IFLS, which is the Indonesian Family Life Survey, started in Indonesia, and it started in '93, and they had 3 waves. But then in 2007, in their 2007 wave, they made themselves also comparable to the HRS. So that's kind of when we say their introduction into this family of surveys started. JSTAR, the Japanese study of aging and retirement, is a panel survey of Japanese 50 and older. It's started in 2007. The baseline sample was drawn from 5 municipalities, and then in every wave so far, they've had 3 waves, or 3 waves of data released. They've added more municipalities, but it's not currently nationally representative. SAGE is another multi-country survey, and it's the study of global aging on adult health, and it's conducted by the World Health Organization. Their first wave was in 2007 and included China, Ghana, India, Mexico, and Russia and South Africa. TILDA, which is the Irish longitudinal study on aging, started in Ireland in 2010. They have a great resource of clinical health assessments every other wave. They're a very interesting study. CHARLS, which is the Costa Rican longevity and healthy aging study, started in 2005. CHARLS, the Chinese Health and Retirement Survey, started, and that's ages 45 and older, started in 2001. And the CHARLS sample was drawn from 150 counties in 28 of the Chinese provinces. And then LASI, the longitudinal study on aging, their pilot was done in 2010, and their baseline is planned for next year. And the baseline, this will be the largest of any of these studies, respondent-wise. And the baseline sample is nationally representative for the whole of India, but it's also nationally representative for each of the individual states, which is also a great resource. So all of this kind of family of surveys have similar core content areas, and these content areas include health, cognition, diseases, physical functioning, physical health measures, health behaviors, things like smoking, drinking. They also cover health insurance, health services, utilization, healthcare, and healthcare expenditure, out-of-pocket spending. They cover employment and the labor force. These are retirement studies, so they really focus also on retirement, the experiences of transitioning. You know, most of these studies start from, between 45 and 55 because we want to capture people moving into retirement. The economic status, they include a whole host of income and wealth, consumption, earnings measures, so you can really build a whole kind of portfolio of someone's financial health. And they also include a lot of family structure variables, so social network, family demographics, family support, social participation, things like attending religious events, marriages, frequency of interaction with family members and friends. So it's really multidisciplinary in that regard. So a lot of different things are covered. And I'm going to talk just really briefly about some key innovations of this family of studies. And one was enhancing the quality of economic data. And we'll talk about non-response bias and some ways that we address that. And then we've also, a lot of these studies have added biomarkers into social surveys. And this is really powerful. Genetics is a field that a lot of people are investing in. It's really nice because with these surveys, you kind of have a host of phenotypical or behavioral information about these people. And then we also get genetic and biomarker data about these people, which can be combined quite powerfully. So let's just briefly talk about non-response if you don't come from a survey design background or an economic background. But there's different kinds of non-response. One is unit non-response, which is someone, they get selected, this household, to be in the survey, and they say, hey, I don't want to be in this survey. There's also item non-response, which is when someone says, hey, I'm going to be in this survey, but do they get to a question and say it's maybe it's a sensitive question. It's something maybe about sexual history or about religion or about it could be income or asset, right? And they don't feel comfortable answering. So they participate in the survey, but they have missings for certain questions. And non-response rates are increasing, and they're particularly high in economic data. So unit non-response rates between 10 and 30% now becoming more common as overall income levels increase. And the kind of implication of this is that there's loss of information and precision. To do analysis with missing data, as you all probably know, what happens is if you include missing data in it and you do your analysis, that basically what happens is that all those missings are are dropped out of your analysis. So you can get a real non-response bias when that missing is non-random. And the missing is generally non-random, like especially with economic data. It's going to be people who are on the very high end, and either it's too hard to calculate the amount of wealth or income they have because it's multiple sources and multiple accounts, or they might feel uncomfortable talking about it, or on the very low end. And similarly, because they might feel uncomfortable saying, okay, I don't have anything in these accounts or something like that. And non-response in the U.S., so this is just kind of an example of non-response for one of the oldest longitudinal studies in the U.S., which is the PSID, the Panel Study of Income Dynamics. And you can see that as it goes on, that non-response has become a bigger, item non-response has become a bigger and bigger issue in the PSID. And so this is one of the things when these studies were being designed that they really wanted to take into account how to deal with that unit non-response. So one of the ways people do this is unfolding bracket questions. So wealth, assets, and income questions are typically sensitive with high item non-response. In the U.S., it's common for 20 to 25% of observations missing from financial variables in national surveys. And so starting with the HRS, they started using unfolding bracket questions, which is, if I say to a respondent, if I'm an interviewer, if I say, do you have a checking account? And they say, yes, I have a checking account. And then we ask them, so how much do you have in that checking account? And they say, I don't know. So without unfolding bracket questions, you kind of stop there. But using these unfolding bracket questions developed by the HRS, then the interviewer would say, okay, well, do you think that amount is more or less or about $50? And then based on that, so this is why it's called unfolding, you would get some more questions. So unfolding bracket method can cut the proportion of missing data by 2/3 because what you're going to get is a nice band where you know that there's an acceptable range with which you know that their income is inside of, which is going to cut down on a large portion of the variance. So let's just look really quickly at unfolding bracket questions. So for instance, someone says, hi, do you have an IRA? And if the respondent answers yes, they say, how much total do you have in these accounts? And if the respondent says, I don't know, or I don't want to answer, this question, this is from the HRS, would ask, would it amount to more or less than or about 25,000? And if they say no, then the next question they get asked is more or less or about 5,000. If they say yes, they get asked more or less or about 50,000? And if they say yes to 50,000, they get asked more or less or about 100,000. So what you've done, because there's a lot of people who will say I don't know or I refuse, but then they'll still give you some more information about these brackets, about the kind of the range of values that is probably in that account. And then what you're able to do with those is imputation. So imputation is going in and assigning values to those missing values that we think are best and aren't going to bias your analysis, but is going to account for, is going to help mitigate some of the non-response bias that you might get if those people were dropped. And generally, again, especially with financial data, you'd be dropping, really important people because it's non-random. You'd be dropping people at the very high end and the very low end that you really might want to include in your analysis. So there's different kinds of missing here, and this is missing completely at random, just meaning that it's random. An example of this would be a GPS device that cut in and out, right? So it has nothing to do with people. But there's it's completely missing. And then there's missing at random, which is there's missings. It's probably not completely random, like it's done by a GPS device, but it's not based on observables. And an observable is like gender, education, something like that. And then there's missing not at random, which is what we often see. So it's missing this dependent on unobservables. And an example of this would be use of land, which is illegal. So people might not want to report that. And that'd be, a missing that is completely dependent on something that's completely non-random. So there's different ways of imputation, but basically imputation allows you to do this. And so the HRS, every version of the HRS is kind of released with a version of the RAND HRS, which is kind of a large, easy-to-use version of the HRS data, which includes imputations. And then also we'll be talking about the harmonized data sets that we produce here, which also include imputation. So if you're not an economist and you don't feel comfortable designing an imputation process for yourself, you'll have these data for you. We also added I've added physical measures. So for instance, some of these are very standard: height, weight, waist or hip circumference, blood pressure, grip strength. Grip strength is really interesting. It's found to be very predictive of longevity. Lung function using a puff test. We'll do a timed walk where someone walks along kind of a pad and time it, or walks a certain distance. How much time it takes for someone to stand up from a chair is another test. Also a balance test. And then in recent years, studies have also begun to collect blood, and so this is used for genetic data. So here's just a brief overview of the different types of blood that some of these studies have started to collect. So ELSA, which is England, TILDA, Ireland, CHARLS, which is China, and MHAS, which is Mexico, actually collect whole blood. And then an HRS for the US, LASI for India, just Germany for the SHARE, the European survey, and IFLS, the Indonesian survey, collect dried blood spots. And most of the other surveys currently do not collect blood. And so then they can release, using these blood, they release genetic data. So the HRS and ELSA both ran a GWAS, HRS using a saliva sample, and the ELSA using a whole blood sample. The HRS data is currently available. It's a restricted data. It's a special data that you have to get access to use. And for ELSA, I think their data is going to be available starting, I think, December 10th. They have a meeting that they'll release their genetic data to people outside of their funding organizations. So all these data together provide really a rich basis for comparative analysis of health, social support, economic well-being, and lots of other measures. And there's an opportunity to study effects of different types of health and pension systems. A lot of the power of these surveys is that about looking at something between different countries is you can look at the effect of a pension system or a health system or a health insurance system between different countries and measure those effects. So there's training opportunities in survey design and cross-national research. And then there's also between these, we really try to share resources between these surveys. So there's opportunities for collaboration with international scholars in demography, economics, and health. And then one of the things in the particular grant, one of the grants that funds our center, is we do ex post harmonization. So to facilitate cross-national comparative studies on aging using a family of HRS data around the world, we developed a set of domain-specific user guides. So there's a particular research domain you're interested in studying. We kind of have a user guide for how you might compare that between different countries. And then we also developed the Gateway to Global Aging data. So here are those domain-specific user guides. So we have, and we're adding to these regularly, but currently we have one on chronic medical conditions, financial transfers, expectations, employment and retirement, income, wealth, and cognition. And I'll show you where these are on our website, how to access these. So that's kind of our introduction. So let's talk about the Gateway to Global Aging data, which is at g2aging.org, and many of you have probably used this resource before. But I want to just go in a little more. Maybe you've thought, oh, I don't understand this, or I'm sure there's the other things this website does, so we kind of want to maybe fill in some of those gaps for you. So the Gateway to Global Aging data includes a lot of different parts, and one of those is a digital library of survey content. And then we also include illustrative flowcharts showing skip pattern. We built an intelligent search engine to locate relevant survey items. We include integration with data to match survey items to dataset variables. We produce harmonized data files for cross-country analysis. We also have a survey concordance to quickly identify comparable survey measures. We've built interactive graphs and charts, and we are in the process, hopefully to be released very beginning of next year. We're building a library of relevant user guides and articles, so you could go in and say something like, hi, I'm interested in studying volunteerism in England and the US. Can you show me, using HRS and ELSA data, can you show me all the, or give me a starting place to look for other literature looking at volunteerism using these studies, which can be a great resource. So we're going to kind of talk through all of these. But let's talk about what metadata is. So here I said we include a digital library of survey content, and let's jump quickly into our site. So if you're on the web, this is the Gateway to Global Aging data, and currently I'm not logged in. And let's just kind of browse. So this is kind of the first function, which is say surveys at a glance. And what you can see here, these are all the studies that are currently indexed in the Gateway to Global Aging data. So we have all these studies that I've covered: HRS, MHAS, KLoSA, SAGE, TILDA, CHARLS, LASI, and we'll also be adding CORELIS, that Costa Rican survey, over the next few months. And then one of the nice things about this view is you can also see in what year they were conducted. Because you notice that most of these surveys identify by waves. So wave 1 of the HRS was conducted in 1992, but wave 1 of KLoSA, the Korean survey, was conducted in 2006. So if you're interested in looking across a particular year, you can say, hey, I'm interested in 2008, and then for 2008 that you could look at HRS, ELSA, KLoSA, or JSTAR. And then let's kind of browse down into this and kind of see what we index about these surveys. So for instance, if we go to share wave 1, so that's the 2000 wave of share, you can see we have all the survey modules here. So surveys are usually divided into modules. So they have a demographics module, a health module, a behavioral risk module. Let's go into this health module. And so here are all the individual items which make up that survey. So you can see at the beginning here we have a lot of just ID variables. You can see here we have type ID. You also have this computer-generated, this constructed variable right here. And then we get our first question, which is called, in share language, PH002. And we give you the description, so health in general, question 1. So let's go into that. So this is all the metadata that we have. And we say metadata in a way to distinguish it from microdata. So microdata would be what were the actual answers to this question. Microdata is if you download a data set that has rows and observations and includes all this data. And I'll talk about how you access the microdata for these. But this is all the metadata we have. So we really try to go through all of these surveys and talk about exactly what was asked in the survey, when it was asked, what were the answer choices, and some other things. So you can see here we have this question that was health in general, and it's version 1. And the question text is, how would you say your health is? And it's enumerated, so they're going to get a list of answers. And the answer choices are very good, good, fair, bad, or very bad. We also let you know this item is used in a harmonized survey, which I'll talk about later. Don't worry about that right now. And then we also say associated variables. So this variable name here is the linkage between the microdata and the metadata. So in share, this is pretty easy because share labels its variables with the same name, that's its microdata variables with the same name as the question if you were looking at, at the survey itself. So question PH002 is stored in a variable called PH002 underscore. This is not as simple for every other study. For some of these studies, you have to go to a crosswalk and kind of see how they labeled their variables to match them to the question. So we've tried to take some of that work out of here for you. So we let you know that the microdata, if you have this data set, if say you're interested in using this question, so the answers to this question are stored in the data set in a variable called PH002 underscore. We built flowcharts, which I'll talk about in a minute. And we've also, for a lot of these, we've assigned topics. So we say, hey, this is related to health in general. And then one more thing that we do, we say researchers we're also interested in. And we have a bit of cart matching, and we'll talk about what a cart is in a little while. But we do cart matching. So we say, hey, people who looked at this this variable or this survey question were also interested in these other survey questions. So that might be helpful for you. We also, the one thing I didn't mention here is that we also allow for user notes. So you can see here, if you were logged in, and we'll log in a minute, but for now I just wanted to show you things just as a user who isn't logged in. You could add a comment, so I could say, hey, and share, maybe the translation of this question in German kind of has a different connotation. So you could add a user comment there if you knew something about it. And all our user comments are vetted by us before they're posted. So that's metadata. And then we also built flowcharts. So if you're familiar with using these surveys, you know there can be a lot of complicated skip patterns between these. I just saw that we had a hand raised. Let's see. Petri, or Petri, do you have a question you want to ask? I just unmuted you if you would like to ask a question. Okay, I'm going to continue then. All right. So there's a lot of complicated skip pattern logic between these different surveys and inside of these different surveys. So we built flowcharts. So you can see here in this kind of example, here's a flowchart for this question, ever smoke daily? And if the person answers yes to this first question, then they get asked the second question, which is, do you smoke at the present time? And generally this skip pattern is used so that you're not asking respondents questions which don't make any sense, or questions which kind of waste the time, because one of the things you can get is survey fatigue by a respondent who's, some of these surveys can take, more than 2 to 3 hours, and so you're at their house or late at night, they're not interested. So survey logic is helpful, but it also means that you have to account for it, because if you were just to look at everyone who has a value for this first question or for the second question, smoke at the present time, you would also need to account for everyone who said, hey, who wasn't asked that question because they had never smoked. So let's jump into our flowchart for this question, for sure. So we can say locate in flowchart. So we'll pull up this flowchart, which will help us understand why we have this version 1 health and version 2 health. So we start the physical health module. You could say health in general version 1, and you can pull down. So the first question, so we generate this, looks like Share generates a random number, and if the number is 1, then they get asked this question. How would you say your health is? Very good, good, fair, bad, or very bad. And if they didn't get a 1, and I think in this case it's a 5 that they would get instead, they get asked this question, which is how would you say your health is? Excellent, very good, good, fair, poor. So these are two different scales that people use to question self-report of health. This very good, good, fair, bad, very bad, poor scale is usually the kind of the European scale. And this excellent, very good, good, fair, poor scale is the U.S. scale. And you can see that the U.S. scale is it's a little weighted towards being happy, right? Yeah, your options are not exactly the same on the top and the bottom for being happy or for being well or unwell, I guess. So you could see which question was asked, and then we could scroll all the way down and you'd see all the questions that were asked and all the survey logic. And then we can see at the very end of this survey, they use this random number generator again, and they say if you had a 2 before, so instead of a 1, then they're going to ask you this question, and they're going to ask you the opposite health question that they asked the first time. And then if you got a 1 instead of a 2 the first time, again, they're going to ask you the opposite question. So in this case of the first wave of Share, they're actually testing something. They're testing two things, really. And the first is, how do these match up, right? So how does this U.S. scale match up with the European scale, right? If someone says that they're excellent in the U.S., does that mean very good? Or if someone says that they're very good in the U.S., does that also mean very good in the European scale? And the other thing they're doing, because they're playing with the timing of these two questions, is they're kind of considering the effect of whether of asking this question at the beginning or the end of this health module. Because you might say to me very early in the morning, you might say, how are you doing? And I might say, oh, I'm doing great. But then if you were, to come up to me and before asking me that question, then you say, oh, like how did you sleep last night? Are you having any backaches? List for me all the chronic conditions that you currently have. By the end of that question sequence, and in this case, the survey module, you might have a more negative version of your health than you would if you were asked at the beginning of the survey module. So they're kind of testing these two effects, and I like to use this example of the flowchart because I think it's really helpful to see exactly what's going on. So we don't have flowcharts built for every single survey. They're a little time intensive to build because we account for a skip pattern, but we have them for a lot of the surveys and we're continually adding them. We also built an intelligent search. So users can search across multiple surveys and waves using our search engine. And our search engine indexes the question text, the answer choices, the item descriptions, and associated research topics. So these are these topics that we've kind of gone through manually and said, hey, this is a question about health in general. And searches can be filtered for a single study or multiple studies over any given set of years. So let's look at an example. So this search bar is present at all times in the top right corner. So for instance, let's look at smoke. We'll put in smoke there. Say I'm interested in looking at smoking. So you can see we've got all these questions here. Here's one from KLoSA, CHARLS, HRS. It's kind of a jumble. We get almost 500 different survey items related to smoking, which is probably more than anyone needs, but we allow you to filter them. So you can hit search options, filter options, and then you could say filter to ELSA. So say you're interested in looking at ELSA, and you could filter. We might have too many people. Let's see, let me try that one more time. Filter to ELSA. I'm getting a bit of an error there. Let's say filter to ELSA. So you can filter to ELSA, or you can filter to any of the waves inside of ELSA. So we could filter to, for instance, ELSA 2006. If we do that, if we were getting that error, I apologize for that. This usually works. If you filter to it, you would get the questions just for ELSA 2006. So that's kind of one way to find survey items. The other way would be using browsing. So you could go to Browse, and you could go to ELSA. ELSA 2006, we can see here, is in Wave 3. You can go into Wave 3. You could go into Health, right? Smoking is probably going to be in Health. And then you could find the smoking question in here, which I believe is, yeah, there it is. It's about towards the end of the survey. So whether ever smoked or whether currently smoking. And then you could go in and you could look at that metadata. Metadata also, and you can see that we have topics assigned smoking. So that is our search engine. And the last thing I'm going to talk about briefly, so everything I'm kind of focusing on right now are things you can do without having a user account that anyone can do. And it is interactive graphs and charts. So we built these interactive graphs and charts so that perhaps you don't have this data yet, and we'll talk about obtaining the data. But we, in general, don't distribute the data to you, and sometimes there's a process involved in obtaining the data. But say you're not interested in really obtaining the data, you're just interested in looking, comparing something quite simple between different countries, or just seeing whether something might even be possible before you go through and start to apply for access to the data. So let's go to graphs and tables. So we have select variables here. This is clearly not all the variables that you could be asked, but you can see we have some basic demographics, some health variables, financial, income, family structure, and employment history variables. So let's look at this question, ever smokes, kind of that question we just looked at in ELSA. So for England, and let's compare that for England, Italy, how about the United States, and Japan. So for England, we'll be using ELSA data. For Italy, we'll be using SHARE data. For Japan, it will be JSTAR data. For the HRS, it will be, for the United States, it will be HRS data. And then you could pick a year of interest. So let's pick 2006. And you can also, if you select only one country, you could do something over subpopulations, and I'll show you that right after this. You can also filter by age. You can say, hey, I'm just interested in looking at 55 to 64, people 65 to 64, or people, on the older end of the age spectrum, 75 to 84. But let's just say all ages. And it'll generate this table. And this one generated really quickly, which means that it's been generated before. If it's the first time that you generate a table or a graph, it's going to take a little bit longer. But once it's been generated once by a user, then it comes up pretty quickly. So this is interesting. So you can see that England and the U.S. look very similar, which is generally true. And in general, for England, it's about 62% of people and 57% of people who have smoked ever in their life. And these are people in these surveys. So these are people 50 and older. And for Italy and Japan, it's actually quite smaller, right? There's a 42% and 44%, which is interesting. And I will say we're doing a lot of work here in the back end, so these are actually population estimates because these are weighted. We use the weights provided by the studies, and we've taken into account the complex survey design. So these are actual estimates. You can also see a table. So you click on the table, and this will give you things like a standard error, also the ends, if there were any missings, which you wouldn't see on the graph. And then you can download this table as a CSV or a PDF, and you can also download the graph using this hamburger menu here. So that's kind of interesting, right? That more people have smoked, and so let's look a little different. So let's look smokes now, right? Because I think in general people would say, older people in Japan probably smoke more than in the U.S. So let's compare this with just smokes now. Okay, and so this looks a little more interesting, right? So it looks like although older people in the United States are more likely to have ever smoked, they do seem less likely to be smoking now than, say, in Japan. So it's 15% say yes currently, and then there's 19% in Japan who say yes currently. And then one of the other things you might want to look at is there's probably a gender divide here. I would assume in the U.S. and possibly in Japan. So if you look at just one of these countries, you could also so if we, for instance, let's just say just to look at Japan, so unclick these other countries, and then you could look over gender and run that graph to see if there's something that's going on that's being biased by gender. So let's look at a couple of examples. So here's total family income for England in 2004, and here we use a subpopulation also. So we say over 3 age groups. So our 3 age groups, and you can see, which you would expect, is that the distribution of income looks really quite different for people of different ages, right? As people move out of retirement, out of the primary source of their income probably being earnings, to have it being start pulling from a pension or other sources or some kind of government transfer. So you see that distribution really changes between those 3 age groups. Here's another cross-country example. So this is currently working for pay in 2006, and this looks at Germany, Italy, Netherlands, England, and the U.S. You can see it's really high, the amount of people currently not working for pay in this age group, which we said we filtered for this age group, 55 to 64, because these are kind of people we would expect to be, working pre-retirement in general, depending on their health. So you can see there's a lot of cross-country variation and currently working for pay. And here's just one example with the graphs and charts for a table. So this is net value of primary residence in the U.S., and you can see we've done this over a set of years. So we've said 2000, 2010. And one of the things you can see here, if you look at the median, is you can kind of see the effect that the recession here in the United States and falling home prices had between 2006, 2008, and 2008, 2010. That really would have affected people's probably wealth portfolios. So it's this kind of a fun tool that we built to play with it, to play with the data before you actually download it, or if you don't feel comfortable running these regressions yourself, you can get an idea of what's going on. So I believe probably most of you have already registered, but to register you would visit our website. So if you're here, you would just click register up here. Registration is really simple. It's an automatic approval. We just like to know who you are, and we ask you to agree to some conditions, saying, if you publish that, you'll list that you use the website and things like that. But let's log in because the rest of the examples that we're going to go through require you to be logged in. So now I'm logged in. I can see my name. This is kind of our example user here, Jane. So I'm logged in. I can see now I have, it says my item card is empty, and we'll talk about what that means briefly. Also, to register, you'll get a confirmation email that you have to click on. That's kind of the one check that we have. So I told you earlier that we have integration with Stata. So let's talk about what that means. If you're not familiar, Stata is a statistical analysis package similar to SAS or SPSS or R. And it is the one package that we currently have integration built in. We're in the process of adding SAS and SPSS integration also, but those are probably a year to 2 years down the road. So for instance, say you've gone to the Health and Retirement Study website and you've downloaded the data. You've got it on your computer. You could then use the Gateway to Global Aging data and with data to link, again, like I was saying, we include that linkage between the variable names in the microdata and what was asked in the survey, which can be quite helpful because usually those are quite different. And so what we do is what the gateway will do is it will automatically generate a Stata program for you that pulls out those variables that are related just to the survey items that you're interested in. And some people might be really familiar with Stata and they say, oh, I'll do it myself, it's fine. But I think for a lot of people, one of the barriers to using this data is that there's a lot of work just combining different files together to get your kind of analysis data set. For instance, the HRS data, I don't know if you ever downloaded, but it's distributed, for each wave of the HRS, there's maybe 40 or not 40, probably 20 different files that you would download and combine. So it can be a lot of work figuring out, hey, this is a household level file and this is a respondent level file, and how do I merge those together? And I really just need 2 variables from this one data set, 1 from this one, and 3 from this other one. And so we've tried to cut out some of the boring legwork. And really what we've done is we've just tried to provide you a bit of automatic programming so that you can get to the more interesting parts of doing this cross-country analysis. And so let's talk a little bit more about how you kind of set options for this integration with data. So we have a data options page. And so let's look at that if we jump back into the website. So for item cart, here we have, right, it says my item cart is empty. We'll talk about that. But I have this data options. So let's click on data options. On the left here, we have indicate data folder locations. So this would be I've downloaded some data. I've downloaded some microdata, some data sets to my computer. For instance, here I have the ELSA 2002 data. I've got HRS 2006 data. And I've said, hey, this data is stored in a file on my computer, on this computer I'm using, in C drive ELSA data 2002. And C drive, my share is in C drive data share wave 1. And what this allows us to do is that when we generate a data program for you, we'll know exactly where that data is, which will allow you to just run that program automatically without going in and saying, changing all the file names. Again, we're just trying to kind of remove some of those barriers for you as you just get started using this data. And then the other thing that we have here is a prepend.do file. A do file is a Stata program. That's the extensions Stata uses for their programs. And these are just some helpful commands. This is pre-populated for all users that you might want to include before it runs. And you can change these. For instance, if I know that my memory is kind of limited on my computer, I could change this to 300 or something, and you could update it. And then every Stata program that was generated by the gateway for you would have that 300 memory set on there. So let's talk about what it means to create analysis data and those item carts, which I've mentioned. So an item cart is a collection of survey items which are specific to your research and stored together in one place based on your user profile, based on this person, on you or me or Jane in this case who signed in. So to create analysis data cart, you can search for relevant survey items. We talked about how to do that with smoking. You could browse also. You could go through a survey and say, hey, I know this survey in this wave and I know which module it's in. You can also browse by topics for relevant harmonized survey items. And we're going to talk about harmonized survey items really briefly. Or you can use predefined carts. So let me show you. So if you click this tab here for create analysis data, we've kind of provided some more information for you about searching, browsing, browsing by topic, and using predefined carts. And so we have, right now we have these predefined carts, which are for the RAND HRS, and then these harmonized versions of these studies. And so if I clicked this cart right here, what that would do is it would add to my cart. So here we go, it jumped into my cart, and it's added all of these items. And these are just kind of like, we call it a base cart because it's all the items that you might just kind of want to throw in and include. Like in this case, we include weights, we include total, just a total income measure, a total asset measure, the number of people in the household, whether someone responded to each wave, interview status, self-report of health. These are just really basic variables which we just, when we use the system ourselves, we're kind of putting similar variables always into our cart. So we just said, hey, I bet there's a lot of other people doing this. Let's do it. So let's clear these out because we're not going to use these right now. Remove from cart. And you can also, so you can access the base carts, but you can also access them if you're in your item cart, you could access them here. So here's these base carts, and you could say load or append. To load means to replace your current cart with this base cart, and to append just means to add these to your base cart. So let's look through a quick example. So let's say we want to compare whether health limits any paid work in 2006 between the US and England. So we could select variables from the HRS and from ELSA because we're looking at US and England. We're going to make sure that we've listed the file locations for these variables that we've selected. We're going to create a cart. We're going to add anything else that's of interest to us, and we're going to download and run a do file. And the result's going to be one data set with information from 2 studies. So let's briefly look at how we would do that. So you can see here we have some saved carts already. So one thing you could do is you could go into search and you could say health limits work. If we wanted to search for this is what we're interested in. And then I think if our search were working well, this would work a little better. You could limit it to ELSA and to ELSA 2006. We could say, okay, but we're getting this JSON error, which I need to fix as soon as this is over so that you all can start using this. But if we're also into our cart here, let's go to our cart. You can also see that I've saved some carts. So let's load this cart that I have, this example cart. And it's going to say it's going to clear our current cart, which is fine. We don't have anything in our current cart. And so now we've got this variable called HELWK, which is whether health limits paid work, and KM002, whether health affects paid work. So I've saved these. And how I've done this, I'll show you really quickly. So for browsing, let's go to HRS 2006, so wave 8, and then this is inside of, let's go to ELSA. ELSA is a little easier. They have less modules. So let's go to ELSA 2006 wave 3, and we'll go into work and pension. And then if we want to define this question, to add to your cart is really simple. So you can just click this add to cart button, and you'll get a green arrow. And then as soon as you do that, you can see we've got more items in our cart. So we're just adding items to our cart now. So that's how we would add these items to our cart. But let's jump into our cart as we have it with these 2 items. And I've got some other saved carts. So I've got this ELSA 2006 basic demographic. So let's append that. Like maybe that's going to be helpful. Then I've got this HRS 2006 basic demographics. Let's append that. So one of the things we allow you to do here, I've showed you these saved carts. And so to save another cart, you would just say select all and save cart. And then you can give this cart a name. So I'm just going to call this webinar example with additions. And you can just save this cart. And what that allows you to do is anytime you come back into your user profile, you can load up that cart because maybe there's different things that you're interested in using at different times and you don't want to forget them. So we allow you to do that. But right now we've got this. And so let's say create.do file here. We've got all these selected. We've selected all our variables, and we can say create.do file. And so what this is going to do, actually, let's first. So we also have this status, which I haven't mentioned, this status column, which is if you hover over, it says you have not indicated the location of this data set. And then you can see with this HRS data that I've got a check, which means I do have the location. So let's jump into data options, and let's list a location for ELSA 2006, because I've already have that data saved here. And right after this, I'll show you, so say you don't have some data that you're interested in, what do you do? So this ELSA 2006, and I know that I've got it stored just the same as my 2002 data, but I've got it in 2006. We also include some basic information here about which version of the data we're referring to, because the versions can change also. So let's add that data set location. So I'm telling the gateway exactly where on this computer I have, or Jane has, this file stored. So let's go back to our cart now. And so let's select all. You can see we've got green status indicators for everything for ELSA 2006, so that's great. And we can create this do file. And I'm going to open it with just WordPad right now. So we'll bring this over. We'll blow it up so you guys can see this a little better. So in this case, it's just really simple. Like, this is a very simple example. So you can see that first we pull in this ELSA 2006 data. It knows that the variables I'm interested in, are going to be stored in the file name, which is this, and it knows that it's stored here because I just told it that, right? And so it's going to pull this data in. It's going to keep these. These are ones we asked for. And then it's going to append, so it's also going to pull in some HRS data, and it's going to keep all of these variables. And we have to pull in 2 HRS data sets here. You can see there's also some variables which we didn't specify, right? Things like this IDA unique or this household ID. So every time that we create a data set for you using this data program, we also include all the basic identifiers so that if you ever wanted to go back and mix that with other ELSA data, that it's always there. We don't want to break any functionality between the original microdata and a data set that is generated by the gateway. So that's kind of one example we walked through. And if I were to run that, so I just showed that to you how it would look, and I could click run in Stata, and the nice thing is it would run automatically because I've already got my file names in there. So let's say I ran that, and this is what you would get. This is the output. So here, so you can see here we have this kind of the breakpoint between the HRS and ELSA data. So you can see we have the HRS data up here. We've got, here's the variable that was of interest to us is KM002. And here's the kind of the weather health limits work in ELSA that was of interest to us, and LWK. You can also see there's some differences here. It looks like in the HRS data, which is true, the answer to this question is yes or no, but they store those as 1s and 5s. And in ELSA, they actually don't store them as 1s and 5s, and they've also applied value labels here. So what we're seeing is no, don't know. So there's probably some missing codes in there, not applicable. So the nice thing is you've got absolutely everything together in one file for you, and you can start to do your analysis. But we think that we could do like a little better on helping you out. So let me show you that example. And how we do that is these harmonized data files. So harmonized data sets are created to provide harmonized measures of international aging and retirement studies. Harmonized data sets define variables as similarly as possible to the RAND HRS definition of a variable. So RAND HRS, again, as I said kind of at the beginning, is this really cleaned, including imputations, very user-friendly version of the HRS, and that's what a lot of people who use the HRS use is the RAND HRS, because it's so user-friendly, and it's probably the most used version of the HRS. So that's kind of what when we produce a harmonized data file, it's what we kind of base it on. So one of the hallmarks of the RAND HRS is that it's in FAT format. So every individual is one record, and then the different years of data. So for instance, for the HRS, you can have years 1 through 10. They're listed out to the right. That's why it's called FAT format, because it's a very long file. And then we use variable names to indicate which year we're referring to. And the variable names kind of use this easy to understand, consistent format. So for instance, a variable like R1 work is whether the respondent is currently working in wave 1. And then variable names also can indicate, for harmonized files, how similar to the RAND HRS version of a variable it is. For instance, if you used a harmonized version of ELSA, and this work variable, instead of being called R1 work, was R1 work underscore E, we use that underscore E to indicate that we're capturing kind of a similar thing about whether the respondent is currently working, but ELSA asked it in a different way. So that information is there, but it's not consistent with the RAND HRS version. And we have a lot of documentation about this also, which I'll show you shortly. The HRS and also the RAND HRS and also these harmonized data sets also include spouse versions of most variables. So for instance, S2 work is whether the respondent spouse is currently working in wave 2. And for researchers who are interested in looking at spousal effects or family effects, this can be really helpful because you don't have to do spouse matching yourself. Like it's already there in FAT format on the line with the respondent. The spouse's values are already there, which can be quite helpful. So you could create a couple measure or a family measure very easily by just adding the two together, or measure a spouse effect by just looking at those two variables. So harmonized data files. So these are the harmonized data files that we currently have. So we have the harmonized ELSA, which is incorporates the first 4 waves of ELSA, so 2002 to 2008. And actually that now includes, I think we just actually, we're in the process of updating that, and that includes now until 2010, so it includes their 5th wave also. The harmonized share, which incorporates the 1st, 2nd, and 4th wave of share. In 2008, share changed their survey a little bit, and they did a life history survey, which we used that data, but they didn't do a regular survey. So the harmonized JSTAR is the first 3 waves of JSTAR, 2007, 2009, 2011. The harmonized KLoSA is the first wave of KLoSA, 2006. We're in the process of updating that to include the next 3 waves of KLoSA, and that should be out sometime towards the beginning, definitely by spring of next year. We have the harmonized LASI, which incorporates the pilot data of LASI. The harmonized CHARLS, which currently incorporates the first wave of CHARLS. And we're also in the process of building the harmonized MHAS for Mexico, the harmonized CHARLS for Costa Rica, and the harmonized TILDA for Ireland. So these harmonized data files are either distributed through the gateway in a couple of cases, or by the originating study. In some cases, the data files are created by users based on a code provided by the gateway. So let's look at this download data and more tab back on our website that we haven't talked about yet. So say you're interested in using data from any one of these studies. So in general, we don't distribute this data for you, right? You have to ask permission to use these data. These data are all freely available, but you have to sign up and ask for permission. So we include here in this top column links to download the survey data. So for instance, if I wanted to download HRS, I could click this link and I'd be taken to the University of Michigan's site where I could sign up for that, sign up to download that data. Then you can also download harmonized data sets. And these are either links to download the data, and in some cases this is a link, and in some cases this is the actual data itself. For instance, for LASI, we're actually the distributing partner, so we distribute LASI data ourselves, that microdata ourselves, and that's kind of the one set of microdata that we distribute. You can also create harmonized data. So here we provide all this data programs for you that we use to build these harmonized data sets. So if you have any questions about how they were built, you could look at that here. And then we also produce codebooks, which I'll show you really briefly in a few minutes. We produce a codebook for you, and so you could download that here. Also, one other thing I wanted to mention, if you're on your topics page, I mentioned these set of working paper series on cross-country comparability. So you would download these here. For instance, if you were looking on this paper about financial transfers between all these studies, you could click here and be taken to that financial transfers page. And so let's talk about what harmonization means, and I'll give you a simple example and a complicated example. So in SHARE 2004, let's look at the smoking question, which looks like that smoking question in ELSA, right? Because these are harmonized before the survey also a little bit too. So the first question is asked, BR00 is ever smoked daily, yes or no? If you say yes, you get asked, ever smoke at the present time. So for the harmonized share, we know we want to make a variable called R1 smoke in, which is whether the respondent smokes now. So it's respondent level. Smoking is something you do on your own. And it's wave 1 because 2004 was SHARE's first wave. And you can see that SHARE uses 1s for yeses, 5 for nos, like the HRS, but all the values that are going to be used for harmonized data sets and the RAN HRS are always consistent between all the studies, which is one of the advantages of using them. So a 0 is always a no, a 1 is always a yes. So you don't have to worry about matching those things up between studies. So in this example of harmonization, it's really easy. So we kind of account for the skip pattern, and we give it a variable name which makes sense. We use the value codes used by all other harmonized studies in the RAN HRS. So ever smoke daily, if you said no, we know that you don't smoke now. But if you said yes, you smoke daily, but you don't smoke at the present time, we're going to give you a no. And then if you said, yeah, I've ever smoked daily, and yes, I'm still doing it, then we'll give you a 1 for a yes. Let's look at a more complex example of harmonization. And this is using JSTAR. And what we're going to do here is we're going to build a household assets measure, and this is just the assets in savings. And savings is one part of kind of a total asset portfolio here. So JSTAR includes 2 different surveys in each wave. They have a self-completion survey, which they mail to respondents before the survey. They fill it out, and then they have an interviewer come to their house later and ask them more questions. So this was a question that was asked in both of these. So if you were going to create a measure of household savings, you would need to consider both the self-completion data and the CAPI data. And the CAPI just means the main survey that's usually done computer-assisted. So you can see you get asked all these questions, right? So the first question is about, do you manage your assets together or differently? And then if you say, yes, I have this asset, you get asked how much. And then you also say, if you have a spouse and your spouse has it, how much do they have? And then in the CAPI, for someone who didn't answer it in the self-completion, then they're asked this again. So the questions change, because in this case they say, do you manage them together? And if you and your spouse manage these together, then you're going to answer for yourself and your spouse in one answer, not separately like in the self-completion. And then the other thing you can see here is that they do a share. JSTAR includes unfolding brackets here. So if you say, yes, as a unit, my spouse and I, we do have savings, and then you say, I don't know how much they are, then you get asked these unfolding bracket questions, which are asked in yen. And so to create this is kind of, I'm just going to walk you through what it would look like to create this this harmonized version of this asset measure. So you would say, so if someone says that they have this amount, and they report it in a self-completion, then our harmonized measure is just that amount. If they say they don't have it, their harmonized measure is just a 0. We know they have 0. In the case that they have the amount and their spouse doesn't, then we know that it's just their amount. In the case that both their spouse and them have an amount, then it's the addition of those. And in the case that they both don't have any assets and savings, then we know it's a 0 for the whole household. This is a household level variable. Let's say you didn't answer it in the self-completion, then we're going to have to go to the CAPI to find this data for you. So in the CAPI, if you give this answer, then we know, because again, it's at the household level now, not the respondent spouse level. So we'll assign the amount if they say yes. If they say no, they don't have it, we know it's 0. That's simple. But then, so they say they do have it, but they don't know what it is, and we get these bracket values, right? And so you have these bracket values, which can be tricky because in JSTAR, they actually allowed the interviewer to fill in these blanks for more or less than for these 3 questions. So these blanks are also recorded in the data set for what the interviewer actually asked. It wasn't automated by the survey. And so then what we've gone through and done for this measure is we've done our own imputations here for household assets and savings. So we've said, hey, I know that it was more than 50 yen, but less than 100 yen. So based on an imputation procedure, which we explain in all of our documentation, here's the value we think we should use, that you don't bias your estimates and you don't lose these people when you do your analysis. So this household assets, I provided a complex example here just to let you know like how much work especially is required for these financial measures. Because like say you're not an economist, so we have a team of economists and programmers who spend all our time doing this. But if you're not an economist or a programmer, and say you're interested, you're interested in a social network thing, but what you think is that social network, there might be some differences that you need to control for between people of different incomes or different wealth portfolios, right? You probably don't want to go through, the months and months of work that it would take to build a total asset, a total household wealth measure, which would include, things like savings, transportation, wealth in businesses, investment, retirement accounts. You don't want to do that yourself, so we've done that for you so that you can really focus on, whichever is your research area of interest. Also, and if you are an economist, you can always do your own. You can do your own imputation procedures and create these own. And then you could use some of our other measures for things that you might not be as familiar with, like education levels. So for all of these, we provide harmonized codebooks. So we really try to be as transparent as possible about exactly what we've done when we created a harmonized measure. So each harmonized data set includes an overview of the statistics for each variable. We detail kind of narratively in text the variable creation and any assumptions made in the creation. We highlight any differences between this harmonized variable and other harmonized variables. We might say, hey, this wealth and savings measure in JSTAR in Japan is somewhat different, and we'll tell you how, than the version in the RAND HRS. And we also list all the variables from the data set that we use to make it. And this is helpful if you disagree with some of the assumptions we made, or if you just want to get started. You can use these a bit as a user guide. You can say, hey, I'm interested in creating a total wealth measure, but I'm not exactly sure everything I need to consider. So we've kind of listed out all the variables that you need to consider also. So let me just show you our code books really briefly. So this is from that simple example from Share for the smoke ever. So we create a measure called smoke ever, smoke now. So you can see here we have the respondent level and the spouse level for waves 1, 2, and 4. We let them know they're categorical. We include some brief descriptive statistics, and these are not population estimates because they aren't weighted, but what they do let you understand is just the distribution of the data in the data sets. You can see that they have a minimum of 0, a maximum of 1, and these are because these are coded 0 and 1, as we know. And we let you know the mean and the number that we have here, which can be helpful. And we also, because it's a categorical variable, we detail the codes. So you can see a 0 is a 1, it's a yes. You can see exactly these are counts, these frequencies for each year. And you can also see one of the things we do is we use these special missing codes that are available in SAS, Stata, and SPSS. And these allow you to assign something as missing, but to give a little more information. So for instance, we use a .d to say it's missing, but it's missing because the respondent said they don't know, or a .r, it's missing because the respondent said they refused. So in everything, we're just trying to give you more information for your own analysis. And then here's that kind of narrative text about how it was constructed. So in this case, we say R smoke ev indicates whether the respondent reports ever having smoked daily for a period of at least 1 year. And the answer to the respondent's first ever smoked daily question is carried forward in subsequent waves. So in wave 2 of share, this answer changes based on their answer in the first wave if they were included in the first wave. So that's important to know, and that's something we take into account too in our harmonization, but we also want to be clear to you about what we've done. We highlight any cross-wave differences. So if this question changed between the first and second wave of share, we could say that here. And then we say differences with the MHAS, and again, that's kind of our basis for comparison. So we say in share, respondents are asked whether they've ever smoked daily for a period of at least 1 year. And in the HRS, respondents are asked whether they've ever smoked daily, regardless of whether the smoking was daily, and not given a definitive period. So this can be really important depending on what you're trying to capture. What is the health consequence that you're trying to capture or control for by smoking, and is it affected by this difference between the surveys? So we try to list that here for you. And then lastly, we list all the share variables used here. So ever smoked daily, smoke at the present time, ever smoked daily. And I'll show you an example from our complicated example. So this is for JSTAR, this wealth in savings variable. So you can see here we have the wealth in savings. It's a household level variable, so it starts with an H. We have waves 1, 2, and 3. We also include a flag, and this flag is important for 2 reasons. One, because we provide imputation, so we're going to flag everything that's imputed and what it was imputed based on. And then JSTAR also top codes. And they do that to protect people, right? JSTAR, Japan is a small country, so there's some concern in the data that they're distributing to people outside of Japan that you could go in and you could individually identify someone. You might say, this person has, I know what province they're in, and they have, they have this much wealth in savings. It's probably like these people or something, and so they top code. So we also flag any top coded value. So again, we include our descriptive statistics. And for this flag, you can see here's our flag. We do the categorical frequencies. So we say whether that value is a continuous value, meaning that the person said, yes, I have savings, and here is the amount. I have 252 yen in my savings account. A complete bracket, which means that the person said, I don't know the amount, but that amount is between 50 and 100 yen. An incomplete bracket, which is they say, I don't know the amount, and the bracket sequence goes so far as to only say, hey, it's more or less than this amount, right? It's more than 100 yen, but when we impute it, we're only imputing it based on knowing that it's between 100 and whatever we find to be the maximum amount of yen that would be reasonable. There's also no value bracket, which means the person says, they say that I have a savings account. I don't know how much it is. And when you start to get into the bracket sequence, they don't really give you any more information. There's also value 6 here is no asset, meaning the person said I don't have a savings account, and we assign them a 0. If the person said they don't know whether they have a savings account, it's level 7 here. So it's also an imputation, but it's an imputation based on very little information. So one of the things you can do here is kind of tell maybe how sensitive your analysis is to these different imputation levels. And then finally, with code 11, we flag top-coded values. And these flags for imputed values are going to be the same for the harmonized JSTAR, the RAN HRS, the Harmonized ELSA, the Harmonized KLoSA between all of these. So it can be complicated, but once you understand what you're doing, it can be quite helpful. And then we have this long bit of narrative text because, as you saw in that example, there's a lot that we have to explain about what happened. But this can be a great place to start. And then we have all the variables used. These are all the variables that were used to create this, which can be really important. And you can see that they're both from the self-completion and from the CAPI. So if you wanted to create a savings measure that was a little bit different, this would be a great place to start because you can know all the variables. And then also, like I said, we also, if we jump back to the website, in the Download Data and More tab, we also allow you to download this data program which created that code. And so you can see exactly how in Stata we constructed it. If we use macros, we provide those macros to you. Again, we try to be transparent as possible about any assumptions that we made. And then the last thing I'm going to show you is our harmonized survey concordance. And this is that browsing by topics. So users can quickly identify comparable harmonized survey measures between all harmonized health and retirement surveys. You can see which topics are currently included in each harmonized study. And we can compare whether individual survey measures are exactly comparable, they're similar, but with notable differences. And in that case, we'd probably, their variable name would be different. We'd have a survey-specific variable name, something like _E for ELSA or _J at the end of that variable name, to indicate that that kind of information is captured, but it's not exactly comparable to the RAN HRS. And then we have it's not available. Like for instance, not all of these questions are asked in all studies, so we let you know that. And then we also have available but not yet incorporated into a harmonized study. And we are constantly working to not only add more harmonized studies, but we also work to incorporate more measures into each study and then to constantly update all of the different waves of each study. So if ELSA releases a new wave, we also include that. So let's look at this topics at a glance. So this is where you can compare these harmonized studies. So these are the different kind of top-level domains that we currently have. So for instance, you could go into health. You can see the RAN HRS, the harmonized ELSA, the harmonized share, harmonized KLoSA, harmonized JSTAR, CHARLS, and LASI. These are these currently available harmonized studies. And then you can see for something like self-reportive health, we can see that, hey, this question is comparable between all of these surveys. We get a C here for comparable. But you could also look at something like mental health, like CESD, which is a measure of depression that's often used. And you can see that it's comparable for the RAN HRS and the harmonized ELSA. And then they do have a mental health kind of summary measure for share, KLoSA, JSTAR, CHARLS, and LASI, but it's similar. And they actually used kind of an alternate version of this. So you can kind of see that information there. So let me just show you really quickly one example using harmonized analysis, going back to our first example, just to show you kind of how nice it can be. So say we want to compare whether health limits any paid work in 2006 between the US and England. So you could select variables from the RAN HRS and the harmonized ELSA. Those variables are going to have a similar naming convention, right? We know it's a respondent level. We have to pick their waves. You can download and run your generated do file, and the result is going to be one data set with easily comparable and similarly named measures from these two different studies. And this is what that data set would look like if you ran it in Stata, which would run automatically. So you can see that we include the country name, the survey that it's from, the unique identifier, and then in this case we have this one variable here, which we've converted it to be a year-specific variable, right? Because the waves are going to be different. So we say, so respondent level 06, 2006, health limits paid work. And you can see that, you can't, in this column, you really can't tell the difference between these surveys because we've said everything is coded exactly the same. We have value labels for both. We have 0 or 1 for yes or no. So that's kind of everything about this brief overview. Thank you all for joining us. We have a help desk. So if you have any questions about this presentation or about you're using the website and you have some question or you'd like some input on whether you could compare something between different countries, whether something is available in the survey or not available, please let us know. And you can contact us with this email, help@g2aging.org. in the website, you can see we have this this help page right here. And here's also a link to send us an email. And then we also have some frequently asked questions, maybe something I went over today that you'd like more information about. And then we have some instructions for common tasks, something like searching or browsing or making an item card or creating an analysis data set. So we've got some things there, but please send us an email. We always try to respond to an email within 24 hours if it's during the week, and sometimes even on weekends. We built this tool for other people to be able to use, and I think we really care about the people who use it. Yeah, so please send us an email if you have any questions. Yeah, so thank you very much for joining this presentation today. And if you have any questions right now, feel free to let me know. You can just raise your hand in here or write something in the chat, and I will. I'll make sure to unmute you, and I'll give anyone a chance to answer a question right now.